Hey everybody, it's Living Life MD and this is episode 3. And today we're going to be talking about the top 5 things you can do to optimize time with your primary care provider. So as usual, if you find something that you like about this video, please hit the like button. If you find something that resonates and you'd like to share with others, please feel free to share. As always, I'm looking for people who are willing to subscribe to my channel. And as usual, if you like the information in this video, please remember that it is informational and educational only and does not take the place of normal visits with your primary care physician. So with that, let's get started. So the first thing that I kind of wanted to do was sort of give everyone an idea of what primary care physicians are really supposed to do and why they're actually really important and in some ways kind of an endangered species in healthcare. So primary care providers, generally speaking, are supposed to coordinate the care between themselves and various specialists that a person may need, like cardiology or kidney doctors or endocrinologists or rheumatologists, and kind of coordinate that care, be that hub that someone needs in order to make sure that all of their needs are being taken care of. Another really important aspect of primary care physicians is they focus on preventative care. So sometimes that's like your cancer screenings that you may need at various times in your life, vaccinations if you're so inclined to get them, just sort of regular updated maintenance of your physical condition. That's what they're really there to do, is that preventative care to make sure that you maybe don't get sick with chronic health conditions like diabetes or high blood pressure. The thing that's kind of scary in this country is that 45% of all primary care physicians currently are age 55 or older. So they are all kind of entering that time where they're looking to retire. And what's even scarier is that the other 55% who are under the age of 55 are actually looking to get out of primary care and either engage in a second career or just retire altogether. Out of healthcare. And I think that's really scary because we still need these people to keep up with all of our preventative care to try to keep us as healthy as possible, so that as we enter our older years that maybe we don't have as much health problems as some people do now, or if we do develop health problems, that they're there to help coordinate that care between themselves and specialists to make sure we stay as healthy as we can with those chronic health conditions like diabetes or hypertension. So it is kind of scary. We're seeing a primary care shortage in America. They do play a really important role, and they can be filled in different ways. Obviously physicians, I'm a physician, and so there's a lot of primary care physicians out there. Family medicine and internal medicine are generally considered the primary care. For adults, pediatricians would be considered primary care for children under the age of 18. Geriatricians tend to be people who do look at not only preventative but chronic healthcare conditions of people ages 65 and older, so the older population, although those can be seen by family practice and internal medicine doctors as well. Nurse practitioners and some physician's assistants are often primary care providers as well. They can be very excellent clinicians. They just have a different form of education and training, but they can also be an important part of a care team. So I just kind of wanted to give a little bit of background because I feel like primary care is one of those specialties that people often overlook and they don't really think about how important they are to a healthcare system. My husband's a family practice doctor, so this is really kind of near and dear to my heart. I see my colleagues in primary care work so hard every single day, trying to see as many patients as they can. Oftentimes they work 12 to 14 hours a day because of all the paperwork that's involved in seeing patients. So they'll see patients for 10 hours a day and then they spend another 2 to 4 to 6 hours trying to get all the paperwork done. So they're very, very hardworking. So I think the other side of this, of course, is the patient side, the you side. What's important for you to know? to make sure that when you are with your primary care doctor, that you're getting the most out of that visit. And I think that's really important in a lot of ways. So that's what this video is about. So let's get started. So the number one thing that you need to do, especially if you're a new patient seeing a primary care physician for the first time, is make sure that when you receive new patient paperwork, which could be in the form of snail mail or email, is that you complete the paperwork ahead of the visit. And if at all possible, make sure you send it back to the primary care physician's office ahead of time. Don't necessarily wait to fill it out or bring it with you to an appointment. If you can get it there before time, that would be great, because then they have time to kind of input all of that information into the electronic medical record so it's ready to go for your visit ahead of time. The number two thing to do is make sure you bring any medications that you're taking. Make sure you bring the medication bottles with you, or if you have a nice list, that's great too. Have everything written out, your dosage, how many times a day you take it, the name of the medication, why you're taking it, and if you need refills. Very important information to have. It really streamlines the visit and allows the doctor to be able to get any refills that you need ahead of time and have it ready to go during your visit. The number three thing that you need to do is know your family history. Know your medical history, your surgical history, but especially your family history. That can be so important because it really helps us be able to determine what kind of maybe cancer screenings or other preventative care that we may need to focus on either in that visit or in upcoming visits. So it's really important that you know your family history and that you bring that with you. And I think that's one of the things is your social history, your medical history, your family history, all those kinds of things, that can also take up time in your visit. So if you know it ahead of time and can give that to the medical assistant or the nurse prior to the physician entering the room, that's a great thing. I think the number four thing that you need to know is you can't bring 10 or 20 things that you want to ask the physician about. Here's why. Most new patient visits or even established visits are somewhere between 50 minutes and 40 minutes. 15 minutes and 40 minutes. I think that's really important because the time goes by so much faster than you think it would. And part of that time is taken up by making sure that the MAs ask you the questions that they need to do. Make sure your vital signs are taken and ready for the physician to view when they come into the room. And that takes up a bit of time in your visit. So you want to make sure that everything is as streamlined as possible and you're as organized as possible. But if you have 10 or 20 things, there's absolutely no way that a primary care physician or a provider can handle in a visit. Even if it's 40 minutes, I promise you that 40 minutes will go by fast and you won't be able to get through everything. So it's really important that you try to limit your questions or concerns down to maybe 2 to 3 in a new patient visit, and certainly 1 or 2 in an established patient visit. And above and beyond just having time to really talk to your physician and be able to get the information you need about a few concerns or questions that you may have, it's also important to remember that they have patients either before you or after you, and they need time with their primary care physician or provider as well, just to make sure that your fellow humans, the other people in the world that also need care, are getting care in a timely fashion. I think that's the biggest thing that people don't really realize with primary care physicians, how much they go from one patient to another, to another, to another, and how stressed they do feel when they're late for a patient. They don't want to be late any more than another, but they want to make sure that they take care of you as thoroughly and as well as possible. So you can help out your fellow man and you can help out your primary care provider by just making sure you don't have 10 or 20 complaints. Just try to keep it 2 to 3 in that new patient appointment, or 1 to 2 in an established patient appointment. And I promise you, your primary care provider and the patients after you will really thank you for it. So I think that brings me to number 5. The number 5 thing that you can do is make sure that if the primary care physician wants to see you back, go ahead and get that appointment scheduled as you're checking out. I think that's really important, and make sure it's at a time and a day that works for you. It is really hard for primary care doctors to have what we call late cancels or cancels within a 24-hour period, or people who just don't show up to their appointments. If they need you to have a follow-up, there's a reason why. Maybe it's a medication titration, maybe it's to make sure that you have all your questions answered about what you wanted, what you discussed before in a visit. But these are all things that are super, super important. And if you don't show up to a follow-up visit, it is really hard to kind of maintain that good relationship and kind of a consistency in your care. So I think the number 5 thing is make sure you schedule your appointments ahead of time. Make sure it's at a time and date that can work for you. If that's hard for you to do, if you have a job or things are more difficult, make sure you talk to the primary care doctor about that so that they can try to find a visit that is most closely related to a time that you can be there for, because it's really, really important. And yeah, that's the top 5 things you can do to optimize time in your primary care visit. Again, time is precious. Time is precious for you and your primary care doctor. And if you can do everything on your end to streamline the visit, and the provider does everything they can do on their end to streamline the visit, then really what it fosters is a good working relationship where you can have shared decision making and you understand what's going on in your health conditions. And if you don't have time to ask all your questions about your health condition, then by all means, you can always drop a question in the comment section. I'm always happy to answer questions. If you have a question, then I will do a video on it and try to answer your question. But I think streamlining your visits and optimizing the time you have will just lead to a lot better patient-physician relationship, and one where you feel like you're confident in what they can do for you. So that's everything. I hope you tune in to episode 4, which is the top 5 things you need to know about diabetes. There is so much more than 5 things that you need to know about diabetes, but I'm going to just try to kind of ferret out those top 5 things that you need to know to get started. As always, take care of yourselves, take care of your family and friends, and thanks for watching this video. See you next time.